Thank you, Stephen, and it's such a pleasure to welcome you all, and thank you so much for coming to share both this launch and also my birthday. But I know how it is, really. I feel a bit like the Queen, who has a number of birthdays, and this is my professional birthday, so it's a tremendous pleasure that you're here, and so many friends and colleagues sharing this evening. So I hope this will be a double pleasure, both in terms of the material which we're now developing and moving forward with, as well as to share that. So the idea, question was, how do we move on to the field of intervention? And I've always been interested in the way in which effective approaches to our work can be brought together. So some years ago, with Warren Kinston, colleague of ours who was involved with the family assessment, and I wrote a chapter in a family therapy text on bringing together systems, ideas, and psychodynamic thinking. So this idea of bringing together approaches which are effective has always been in my mind. So it was when I read the work of Garland and Bruce Chorpita and Daleiden, 2008 and 2009, who talked about common practice elements which were distilled from across the field. I mean, as Bruce Chorpita indicated, in the child mental health field there are over 600-700 effective random controlled trial studies, but no one individual could possibly grasp them all. So we all work in silos, systemic, dynamic, and so on. So the idea that there are elements from across that field which are in common and which could be distilled, which is Bruce Chorpita's approach, was very interesting. And the approach which we followed with Ian Elliott from the Lucy Faithfull Foundation, when Hilary was CEO, and working with Bruce Chorpita, was to take the gold standard random control trials on preventing and addressing abusive and neglectful parenting and the associated impairment of children's health and development. So in a way, that's where we began. And so out of that, we devised two basic elements: common practice elements that cut across distinct specialist treatment protocols, clinical procedures and processes. Exposure, so commonly seen in traumatic events, would be seen as a practice element. Creating a trauma narrative would be another key practice element. Psychoeducation on the impact of maltreatment. Intervening in the ABC of harmful and challenging behavior. Those are all common practice elements. And in addition, there are common factors such as promoting an alliance, client motivation and relationships, which are common to all interventions that create a sense of hopefulness and effectiveness. So that was the area that we followed, using the distillation process to develop a series of common practice elements. And then these research findings were integrated by a group of expert practitioners into an intervention approach. And I'm very grateful to colleagues, some of whom are here today, who work together to really see, well, how could we bring these disparate common elements into a practice approach which could be made available to a broad range of practitioners. And you can see there are colleagues from Child and Family Training, from the Faithfull Foundation, from SLAM, King's College, SWAY, some of my colleagues are here, the Child and Family Practice, Claire Gates at the time, and also a colleague, Malcolm Ward, who was in the Southwark Safeguarding Children's Board. So we worked together to really bring together this information, and we developed a step-by-step modules to deliver an evidence-based approach. So this was the approach we take, the elements, building them up into modules, and we organize these into themes, into themed intervention guides for practitioners, using the assessment framework to gather and organize information and to formulate the interventions. So we, first of all, developed two large manuals, but from the piloting which followed, it became pretty clear that this was pretty cumbersome. So we fairly rapidly devised a set of themed guides, and it's these that we've now been working on and which we're launching today. So piloting in 5 organizations was funded by the DFE and Merton and SLAM, and which led to the practice guides being revised and reformatted and the training program to be redesigned. So the current developments which we're talking about today is the editing and publishing of 10 intervention guides, and we've got 3 of them which we have now completed, so that you'll be able to look at those during the next phase with the help of William Baginski, our publication developer, and also the guide editors who've played an important role, many of them whom were involved in the early development. Also along the way, we had an important conference, Eradicating Child Maltreatment, held on the anniversary of Henry Kemp's publication of The Battered Child Syndrome, supported by the Michael Seif and Lucy Faithfull Foundation. And this was the book, and we have some of these copies for you to have a look at. And this was, I think, a powerful element in looking at the whole of our approach, to bring together the best and most interesting approaches to working to eradicate child maltreatment, prevention, evidence-based approaches. So what we've developed is this circle of guides, and you can see that they are arranged around the assessment framework triangle: parenting capacity, children's developmental needs and family and environmental factors, from engagement, a set relating to parenting, and I'm going to look at them in a little more detail in a moment, a set to do with working with children and young people, and also working with families. So what we've tried to do is to develop these themed guides which enable practitioners to be able to provide and deliver evidence-based approaches. And you'll hear something about the way in which these approaches are being currently utilized. So I'm going to very briefly look at each of the guides in turn, just to get an idea what each of them are about. So we began with engagement and goal setting, which was the initial guide. And the important element of this guide is the way in which it's of such importance to link together empirical knowledge and understanding about parenting, family and environment, and about the child's developmental needs, which emerge from the sort of assessment tools which Stephen was referring to, and link it to the family, to create collaborative goals, to work out what is a safe context for care of the child who may have been maltreated, and to work out what are the goals for both the family and the practitioner, developing strengths, building on strengths, and overcoming and dealing with difficulties. So it's important here to see that we have an assessment and analysis, establishing a profile for intervention, engaging children and parents, and promoting homefulness, and goal setting. And of course, goal setting means what's successful and what would be the criteria if, in fact, other arrangements for care of children were going to be required. So we wanted to have a broad approach to this area. working on parenting, and although their focus is on parenting, children are very often present. So the focus is on parenting, both parenting alone and with children together. This particular guide, Modifying Abusive and Neglectful Parenting, the modules which are part of that guide include psychoeducation, because it's key to help parents understand how does abuse affect children's development and what helps. And you can see here, this is the Harvard Developing Child diagram describing toxic stress. And we were very grateful that Andrea Danesi from King's was in the Institute of Psychiatry and was able to really help us understand processes of toxic stress and its impact. Because the focus of the work on modifying abusive and neglectful parenting is on stress, modifying parental stress, because that's a key factor in abusive parenting, modifying negative perceptions, helping parents manage stress, whether it's in the current life or over time, modifying negative perceptions which lead to perceiving the child as deserving punishment, abuse, and then reconciling and clarifying the impact. So that's a guide on modifying abusive and neglectful parenting. Of course, current research on outcome indicates that although it's important to modify abusive and neglectful parenting, strengthening parenting, providing good quality parenting is a key to the outcome for children. And so we have a series of 3 guides which focusing on promoting parenting. So this guide is promoting children and young people's health, development and well-being, and the modules that we focus on here, helping parents identify physical and emotional needs, promoting development early and later, providing good quality basic care and attention to health needs, ensuring safety and protection in the home and community, and nutritional care. And you can see a handout here, what seems to be a series of scripts about talking to parents about what seems to influence children's development. So these modules are important if we're looking at the field of neglect, providing good quality care, providing safety, and require an intense, active, collaborative approach with practitioners and families. So the next guide, which was edited by Claire Gates, who's here, and Jenny Peters, promoting attachment, attuned responsiveness, and positive emotional relationships. And such a core, important issue in current day thinking and current day views about intervention in this field. So that the modules promoting attachment and attuned responsiveness, understanding the concept of attachment, helping parents develop secure attachments with younger children, for children school age, one time, the whole notion of parents being able to respond positively rather than directively and punitively in terms of promoting responsiveness. And then the important theme of providing emotional support in adolescence, because of the balance, of course, young people's needs to find their own identity, but to have continuing support. So an important guide. And for each of the guides, there's developing programs of training to help practitioners and to help trainers train the content of these particular guides. And you'll hear something about the training and the coaching which we find essential if we're going to really ensure that practitioners take on board the important elements of the approach. Promoting positive parenting. Rosemary Roberts, who's not able to be here, has been unwell, but she's given a tremendous support in ensuring that this very key guide is really helpful. And the modules that are part of that approach are praise, providing attention and ignoring, giving effective instructions, reward, shaping challenging behavior, modifying disruptive behavior. And certainly the feedback on this in training, that this has been perceived as a most helpful approach. And here's a behavior rating scale: very good, very bad. So the idea that to give people tools to make assessments, to be able to describe the sort of difficulties that they're having, and seeing what the end points are. Now, so those are the parenting guides. Then looking at the other side of the cycle, important guide of working with children and young people, addressing emotional and traumatic responses. Dr. Tara Weeramantry, who's here, has been the editor for this important guide. And there are two basically areas here, because I think the approach taken is to say that before one starts to specifically help children and young people with anxiety, mood problems, traumatic problems, there's a whole set of approaches that are essential in terms of developing a child-centered approach, helping children and young people, and this is always with the support of carers, and parents who are supportive, understanding the effects of maltreatment, being able to find a context of safety, coping skills, relaxing and calming, being able to describe and monitoring feelings, find activities as a way of coping, and problem solving. And here's one of the worksheets: 10 things I can do to feel better. So these modules are an essential to really help children in a general way before specifically working with anxiety problems, working with mood problems, working with trauma problems, maintenance and building resilience after children and young people have passed through the steps, been supported, and creating positive relationships with family and friends. Here's one of the worksheets: practicing my positive self. So part of the ways of helping children and young people deal with mood problems. So working with children and young people addressing disruptive behavior, Hilary Eldridge, who's here, has been has edited this guide, and with support from colleagues, because obviously when one's thinking of the impact of maltreatment on children's emotional, traumatic responses, disruptive behavior, we know, is an important element and an important response, particularly as children and young people move towards adolescence. And the approach here, an important positive approach, again, enhancing children's competence, a good life, and you can see here's one of the worksheets: an old life and new life, how to overcome them, coping with disruptive behavior, helping children, young people, again with support from carers to cope with disruptive responses, training in more appropriate ways of assertiveness, and making positive relationships. So again, you can see the spectrum of work, and that's really completed working with child sexual abuse. Again, Hilary Eldridge is the intervention guide editor, but we have colleagues from SWAY, other colleagues from the Faithful Foundation, who've played an important role in contributing to the elements of this very extensive guide. Again, the modules key working with parents and carers with children harmed sexually in the family or the community. And then, obviously, it's important to note the linking with other guides, because children and young people are going to need the help of working with emotional and traumatic responses, as well as working children or young people who display sexually harmful behavior, supporting the parents, working with the children and young people directly themselves under 12 and in adolescence. So the final guide is working with families, and Carol Jolliffe has played an important role in editing this approach. And it's important to make a link with one of the approaches which Stephen mentioned, which is the family assessment, and this links with that general training. And the approach here is to promote healthy family functioning, actually helping families converse and discuss in difficult topics and areas, managing conflict and dysfunction, including parental conflict and couple violence, and the important issue of working with family violence, support networking for families in the community, and here's one of the worksheets using genograms. So I just want to say, well, what's inside the guides? And promoting positive parenting is the example which I've taken. And hope you like the circles derived from Australian Aboriginal designs, which we've thought would be an appropriate elemental part of the design. So within, and when you have a chance to have a look at the guides, the three that we have available, and the older guides are also present so you can see the full range. Briefing papers. We've tried to ensure that in each of the guides that the background, theoretical and general background, are included in each of the guides. So this is a briefing document introducing promoting positive parenting modules. The module themselves, here's a module, Understanding Children's Behavior. And you can see here, these are the sort of steps within this module: understanding the causes of difficult behavior, factors which contribute to difficult behavior, how do these factors link to the family and caregiver, understanding the situational context for difficult behavior, and the importance of consistency. So you can see that from the general, the elements, the steps are what are outlined. And here's one of the worksheets: 4 factors that are related to trying to help in working with parents about factors from the child-parent life events which contribute to difficult behavior. Then here's a main step, and this is a script, provide a rationale for why praise is helpful. So this is a conversation, a suggested script. The important thing is that the scripts are helpful, they're advisory, and obviously over time practitioners will find their own voice, but particularly for training for less experienced practitioners to be helped to know and to practice approaches which we found to be effective is a useful element. What do you as a parent think about the value of praise as a way of helping children's behavior? Does it make sense? Do you think there are any benefits? Surprisingly, praise tends to increase appropriate behavior and decrease inappropriate behavior. It works better over the longer term. So you can see these are part of the discussion elements. Then this is a worksheet, the ABC of behavior, antecedents, behavior and consequences. So beginning to talk about this model, and then, well, how can this apply to your child or your young person? Active ignoring. This is an image of somebody who is actively ignoring the noise and fuss going on. So this is a handout for parenting. When is it okay to use active ignoring? Ignore fussiness, complaining, pouting, grumpiness, talking back, making noise, whining, asking the same question, repeating, doing things to get your attention. Don't use active ignoring for hitting, slapping, pinching, throwing, breaking things, and so on. So trying to give people clear guidelines about particular elements. So the intervention resources have been developed to work with the profile of strengths of the family, to try to build protective and resilience factors in difficulties, which are risk and harm factors. The strength of the approach, certainly in the way that from the piloting and from subsequent use, is the modules can fit with the needs of the children and families. Rather than being prescriptive, can be adapted to a variety of contexts and a variety of cultural contexts, and integrated with other approaches. They're not exclusive, and practitioners can find their own voices in the way that these approaches are applied. So thank you very much. Please have a look at them afterwards, and this is the guide to what to look for. So thank you. That's the last one. Right.